Are you worried about your own child or any other young child that you know well who's probably not really looking when you call their name, who does not respond when you talk to them, or may not look around or turn around and look at you? They get upset at loud sounds, or they may have very specific likes and dislikes for specific toys, specific food items, specific activities, and may really dislike other things. They may show behaviors that look repetitive, like flapping their hands or flicking their fingers or spinning around, or may show a preference for things that seem to be repetitive, like lining up things or spinning toys or spinning parts of things. These may be features of a neurodevelopmental condition called autism or autism spectrum condition. In India, 1 out of 100 people probably has an autistic condition or an autism spectrum condition, which means that it is very likely that each of us has met or will meet at least one person who has autism. And for that, we need to be aware that all of us do not act the same, that there will be people who think differently, act differently, approach and perspectives differently. But that's how we all are. We all have our strengths, we all have our own challenges, and that we are not looking towards making everybody the same or making everyone uniform, and that in our differences lie our strengths. If your child receives a diagnosis of autism, here are some things that you should keep in mind. First and foremost, autism is not a disease, which means that we do not focus on a cure. Instead, we think about how do we support this child's development. Of course, there will be therapies that you will be taking your child to support his development, but equally important is that you as caregivers and as parents learn the strategies and ways in which you can support your child's development. Their interaction, their communication, their ability to play across everyday routines in your home settings. Autism looks different in every child. We know that no two children with autism look the same. There's one child with autism who got a diagnosis because they do not speak yet, or they do not look at people, they flap their hands and may not be interested in playing at all. Yes, that can be autism. There can be another child who already knows their alphabets, is able to do a 20-piece puzzle, runs around after other children, but still may get a diagnosis of autism because you as caregivers and the child's doctor may notice that the child is able to speak but cannot have a conversation with others, is interested in children but does not know how to play with them. Autistic people can have any level of intelligence. A child may be autistic and at the same time be very smart. At the same time, there are other children who are autistic and may have challenges in learning new concepts and being able to remember them. Autistic people may have other conditions. Some children may have seizures or what is called as epilepsy. Some may have a hearing issue. Some may have difficulties with learning, paying attention, or hyperactivity. And that is why it is really important that even after a diagnosis is made, you continue to meet your developmental pediatrician or your specialist so that they can keep a note of your child's progress and look at how they are doing. Most importantly, all children with autism will have their own strengths. They will do some or many things really well. You may be surprised to see that some of them may remember things and places that they have been to really well. They may be able to have a good sense of putting things in order and remember what they have heard or seen very easily. Some children may pick up reading very early, or may be very good at remembering numbers, colors, concepts, or even complicated names of things that they have seen and heard. Your developmental pediatrician, together with you, will put together a plan that's specific for your child and for your family. They will connect you or provide you resources for therapists who will then support your child's development. So therapies are specific ways of teaching your child the skills that they are finding hard to acquire. So the different kinds of therapists that you might be asked to meet could include a therapist who's specifically trained in autism intervention and know how to support your child's development in their communication, social interaction, and behaviors. In addition, you may be asked to see a speech therapist to work on the child's speech and language and sometimes difficulties with chewing and swallowing. You may be asked to see an occupational therapist who will help you figure out how to help your child with their ability to attend, to sit in one place, to be alert to things and people in the environment. You may be asked to see a psychologist if there is a requirement for help with behaviors, for social skills, and sometimes things like anxiety and bullying in older kids. A special educator often helps children with picking up academic concepts like learning how, about the association between sounds and symbols, reading with meaning, and so on. A psychiatrist may be needed if there is a need for medications to help with anxiety or sleep. A child neurologist may be required if the child has associated difficulties like epilepsy or seizures or other neurological conditions. And very importantly, you may benefit from meeting a counselor or a mental health specialist who will support you and your family in these times. And always, please to remember that you know your child best and that with the right supports, every child with autism, every person with autism can have a fulfilling and meaningful life. If you found the video useful, please hit the like button and do subscribe.